everybody, I'm Ryan from Ryan Recovers, and today I'm going to be talking about borderline personality disorder. I was diagnosed with borderline personality disorder when I was 20 years old after getting sectioned for an overdose. So I feel like I am somebody who has the ability to talk about the disorder and what it means to have the disorder. So if you want to learn about it, then please stick around. Borderline personality disorder tends to feel like a roller coaster, whether that be of emotions, of relationships that are unstable, or friendships that are unstable, but also a very unstable sense of who you are as a person. Your image, your goals, pretty much everything about yourself is unstable, which is why in the UK, we often call it emotionally unstable personality disorder instead. People with BPD tend to be very sensitive people, and we tend to be empathetic. Very small things can trigger very intense emotions for us, which is why it's very common for us to be very self-destructive. This can lead to us finding it very hard to stay grounded in the moment, which can also lead to things like escapism. So a common form of escapism may be dissociation, or it could be escaping through the use of alcohol or drugs, and often that can lead us to be acting in very inappropriate or dangerous ways that may hurt other people. I know for myself, I have hurt a lot of people from my multiple times spent in hospital, and I've hurt myself physically and also almost damaged my entire reputation, as I have nearly been arrested multiple times. The way that you can kind of realize whether you have BPD or not is whether you identify with the key characteristics of it. So we often tend to feel quite empty inside. It's this chronic feeling of emptiness. Our emotions tend to shift very quickly from feeling maybe very depressed and hopeless one minute to feeling extremely elated and happy another minute. But these shifts can also happen over the course of weeks or months. For me personally, my mood changes, my swings don't tend to last a couple minutes, they tend to last for days and weeks. We tend to be very afraid that people are going to abandon us and they're going to leave us because of how we're acting. And we tend to be very scared of people rejecting us for how we feel. Our romantic lives, in particular, tend to be very intense and unstable. We tend to devalue people, or we will idealize them. So one minute I might think that my friend is an absolute god and that they are amazing and they're an angel and they could do no wrong, and then they might piss me off, and the next minute I feel like they are the worst person alive. We tend to do things that are very dangerous and unhealthy for us, such as binge drinking, doing a lot of drugs, spending sprees, those kind of things. A lot of us have attempted to hurt ourselves or even commit suicide, and we tend to be very impulsive people. The key symptoms of borderline personality disorder are categorized into 9 different criteria, and you have to meet 5 out of the 9 criteria to get a diagnosis, and they have to be impacting your life in a large way. The first of the criteria is a fear of abandonment. People with BPD tend to be terrified that people are all going to leave them. This is usually an irrational fear, but it can, sometimes be rationalized, but usually it is irrational. This can be triggered by small things such as a partner being late home from work or saying something in the wrong tone of voice, and that can trigger a major meltdown. The second of the criteria is unstable relationships. We tend to have relationships that are very intense but very short-lived. They fall in love very quickly, and they can fall out of love just as quick. Relationships tend to be either perfect or they're horrible, and there's not a middle ground. The third criteria is that we tend to have very unclear or shifting self-image. Sometimes you may feel really good about yourself, and other times you feel completely terrible about yourself. This for me is very much shown in my eating disorder. So sometimes I'll feel really good about myself and then I'm able to eat a normal kind of amount for myself, and other times I feel really bad about myself, and that's either characterized by binge eating to try and numb the emotions, or I'll not eat for long periods of time because I feel like I don't deserve to. But this can also be that you just don't have a clear image of who you are, what your religion is, what your gender identity is, what your sexual orientation is, who your lovers are, your values that you hold, the goals that you have in life, your career goals, your academic goals. The fourth criteria is that you would need to be very impulsive, and you'd have to be committing very self-destructive behaviors. So these are usually very harmful sensation-seeking behaviors, especially when you're feeling upset. This could be impulsively spending money, reckless behaviors. I know for myself, this was very much characterized by taking lots of drugs and drinking a lot, going out each night, partying, and not thinking about the consequences afterwards, smashing bottles and cutting my hands open, again, not thinking about consequences. The fifth criteria is self-harm. We tend to deliberately harm ourselves or act in suicidal behavior. This is usually done by making threats of suicide or making gestures towards it, but it could also be legitimately carrying out a suicide attempt. Number 6 of the criteria is emotional swings. So feeling very unstable in your mood is very common with borderline personality disorder. One minute you feel very happy and the next minute you feel really sad. Or again, as I said before, it can happen among days or weeks. They tend to be very intense emotions, but tend to fade quite quickly, which is where it differs from bipolar disorder mostly, because bipolar tends to last for months, whereas BPD, the longest it can really last is just a couple of weeks. The 7th criteria is a chronic feeling of emptiness. People with BPD often think that they feel empty, and they do feel empty, and they will talk about that. It's as if you have a hole or a void inside of you and you don't know how to fill it. It's like you feel like you are nobody, or that you feel just nothing. And no matter how you try and fill it, nothing feels satisfying. There is then explosive anger as the 8th criteria. This is usually trouble controlling your anger and having a very short temper. Again, little things can trigger it. This is usually characterized by yelling, throwing things, hitting things, and emotional outburst. The final criteria, number 9, is feeling suspicious or out of touch with reality. This is otherwise known as dissociation. People with BPD often struggle with paranoia or suspicious thoughts about reality, especially when under stress. You tend to feel very foggy, spaced out, as if you're not in control of your own body. For me personally, I tend to feel like nothing around me is real, and I get very dizzy. And this can go as far as to switching into alters. There are some people with BPD who do experience dissociative alters, where you become a different personality to what you're used to, and you don't remember that space in time when you do that. I am somebody who does do that, but only in extreme stress. And this also encompasses having hallucinations and delusions. The hallucinations are caused by dissociation. In those hallucinations, we can hear voices, auditory hallucinations, which can tell us usually things like degrading comments about ourselves, or they can be things like telling us to harm ourselves or harm other people around us, and it's really hard to block the voices out. In terms of visual hallucinations, for me personally, I tend to see colours and geometric shapes, but one thing that was recurring for me was that I tended to see a lot of shadow people, which other people I know with BPD have also struggled with a lot. It's very common for us. It is common to have co-occurring disorders with borderline personality disorder. Me myself have a big list of different disorders that are comorbid with my BPD. I have autism, ADHD, OCD, an eating disorder, and I was diagnosed with bipolar disorder, though the diagnosis was recently taken away from me because they discovered that my bipolar disorder was drug-induced, and once I became sober, the bipolar went away. It's also very common to have an anxiety disorder or depression with borderline personality disorder. And it tends to be that when BPD is treated successfully, other disorders tend to be treated quite well as well. So there are a lot of causes for borderline personality disorder, but it's not very well researched, so we don't know all of the causes. One of the main causes, though, is that we have a difference in our brain. So everybody has different chemicals in their brains, and for borderline personality disorder, the chemicals are just a little bit different. They're a bit, I don't want to say messed up, but they're not working all correctly. We have a worsened fight or flight response. It's the same with PTSD. And this is because most people tend to believe that borderline personality disorder is caused by trauma. This could be you were abused as a child, or you were neglected, you were bullied. It doesn't have to be something that is severely traumatic for anybody else. If it was traumatic for you, then that could have caused the symptoms that you're now having, if you're having these symptoms. But also, trauma can affect your genetic makeup. Trauma can permanently affect your brain. So, if your parents went through a traumatic experience, or even if their parents went through a traumatic experience, that then changed the chemicals in their brain, which can then pass that down through genetics to the next generation. It doesn't have to be that you experience the trauma yourself. If you're experiencing all of the symptoms of BPD to a severe extent, but you haven't suffered any trauma, then there is a good chance that it could be a genetical link, or it could be environmental. Having a borderline personality disorder has a lot of stigma associated with it. Having any kind of personality disorder has a lot of stigma around it, mainly because when we think personality disorder, that means there must be something wrong with my personality, but that's not the case. When psychologists are talking about personality, what they're talking about is patterns of thinking, feeling, and behaving that make each person unique. And when you have a personality disorder, there is just something that needs to be adjusted in your patterns of thinking, because the patterns of thinking and feeling and behaving that you're having are negatively impacting your life. So it's not that you have something wrong with your personality, it just means that your personality is something significantly different to what is considered normal in society. And it's not that you need to change your personality, it's just that you need to learn to cope with the parts of your personality that make life more difficult for you. Because you don't want to be in and out of hospital every day, and you don't want to be self-destructing and harming yourself. So there are a lot of different ways to treat borderline personality disorder. For one thing, medication is not advised to treat borderline personality disorder. There are medications that you can be treated with, but none of them have been approved by the FDA. There is no approved medication for the treatment of BPD by the FDA. The medications they can give you may help with the symptoms, though. So they can give you antidepressants to help with any depression symptoms. I am just being started on some antidepressants to help with my symptoms. They can also give you antipsychotics to help with some of the mood swings and to stabilize some of the psychosis you might get with borderline personality disorder. I have tried quetiapine, olanzapine, and aripiprazole, and none of them had the correct effect for me. So that's why they're not approved, because they don't work for most people, which is why the main treatment for BPD is actually therapy. Mainly, they have tried using cognitive behavioral therapy in the past, and it has proven to help, but now we tend to use dialectical behavioral therapy. This is my book. This is the book that I will be using here on YouTube to go through DBT and try and recover myself as Ryan recovers. And this is the book that you should all get if you think you struggle with any of these symptoms, or even if you don't, but you want to improve your mental health in any kind of capacity, because DBT really helps reprogram your brain, and it helps you overcome that negative thoughts, and it helps you improve your self-esteem and your confidence. So I really recommend it to literally anyone, even if you don't think you have mental health issues. It's a really good book just for helping your mental health in general. And it is the preferred treatment for BPD by all psychiatrists and psychologists. So that is it for this video. I really hope that you learned something from this, and that I can count on seeing you in the next video if you decide to stick around. Please comment below your stories about BPD or your stories about your own mental health. This is always going to be a safe place to vent about anything you need to vent about, and I hope that I see you in the next video. Bye guys.